Imagine working full time and not being able to afford a doctor's visit. That's the reality for millions on Medicaid. And we're going to go through bullet points today that talk about how it really affects the people. They're trying to take Medicaid away because it's like this waste of money, but it's really not a waste of money. So let's go through these bullet points. What's the impact on people's health? Well, the loss of access to preventative care, millions would lose access to well visits, mammograms and annual checkups and things that you're supposed to do, colorectal screenings, all the kinds of things that we're supposed to do. Vaccination screenings, early disease detection, leading to more severe health issues and longer and higher long-term costs. An increase in uninsured population. Without Medicaid, many low-income individuals, including children, elderly, and people with disabilities, would be left without any health care coverage. Imagine not having any health care coverage, and not just a few people, but millions of people. More emergency room visits. Without Medicaid, people may delay care, leading to more ER visits, which are far more expensive and strain hospitals. Remember when the big COVID outbreak and the hospitals were full and people who had, were in need of regular, like knee replacements or, regular surgery that isn't emergent. There was no way to go in and have those because the hospitals were overburdened with the people with COVID. So, we've already seen what can happen like in a pandemic. But imagine if there was no Medicaid to pay for people who, like I said earlier, they work full time. A lot of people work. Husbands and wives work. They have children. They still don't make enough money to provide for their children. It's a sad world. And we've just laid off 30,000 people plus and more to come who were well-paid people, and they're going out into the workforce now needing another job. So it's going to bump other people out of the workforce. Worsening public health. Medicaid covers crucial vaccinations, maternal care, and mental health services. Without it, disease outbreaks and untreated mental health conditions could rise. Well, that's just what we need is more people under mental health strains running around with no medical care, no medications. And we already have a lot of people who don't want to take their medication because it goes with mental illness. And if you don't pay for it, they're really not going to be able to have it. Imagine a single mom working 2 jobs depends on Medicaid for her kids' checkups. Without it, where does she go? What does she do? You can't go to the ER to have a checkup, right? You go to the ER when you're so sick that you need emergency care. It's crazy. The economic consequences. You've got higher healthcare costs for everyone. When insured people can't pay for care, hospitals raise prices for insured patients, increasing premiums and out-of-pocket costs. Job loss. I've been saying all these things that Trump's doing are affecting everyone. It just hasn't reached everyone yet. Some of us can see the future, right? Job losses in healthcare. Medicaid supports millions of healthcare jobs, especially in hospitals and clinics that serve low-income communities. Cuts would lead to layoffs. More financial struggles for families. Without Medicaid, many families would face medical bankruptcies and severe financial hardships. Burden of state budgets. States would have to find new ways to cover care for low-income populations, potentially leading to higher taxes or reduced funding for other programs. If Medicare goes away, who pays for all the people who got cut off of their insurance? I'll let you in on a secret. We all do. That's what I'm saying. All these things are coming back on all of us. You affect the poor, you affect the rich. The only people who are going to come out smelling like a rose on this thing are the 1% who not only are getting a tax cut because of all these cuts to the lower income people. Who relies on Medicaid? Working adults, about 63% of non-elderly adults on Medicaid are working. Many work in low-wage jobs without employer-sponsored health insurance. And even if they do have health insurance, they have to pay a part of that. And a lot of people can't afford it. You just can't. They can't. Listen to this. Nearly half of all U.S. children are covered by Medicaid. Half. Elderly and disabled, Medicaid funds, nursing home care, and in-home health services for millions of seniors and people with disabilities. Can you imagine what would happen with our elderly who are in nursing homes who need round-the-clock care? I mean, you've got people who work their whole lives, paid for Medicare and Social Security, and then because nursing home care costs so much, even assisted living. My father's in assisted living, and you have a lot of people, you have to spend all of your money in order to get Medicaid. If you have money in the bank, you can't get Medicaid. So what you do is you spend all your money on your medical care, and then you can try to get Medicaid because, assisted living is like $4,000 a month where my father's staying. And I'm in Arkansas, so we're not talking about, and we're not talking about, it's a nice place, right? But we're not talking about top of the line or, those memory care places for people with Alzheimer's. Medicare isn't just a safety net, it's an investment in public health and the economy. Let me know what you think in the comments. If people comment and have questions, we can go through these step by step and talk more in depth about them. We can come back. I can do a live stream and we can chat about it. But that's just going to depend on if you guys have any questions or you want to talk about it. Let me know in the comments. I do appreciate you watching, and please subscribe and hit the like button so that you can be notified when we go live again, especially if you're interested in watching a follow-up to this where we go into more in depth. Thanks for watching. Have a great day.